Mulholland made a significant change in his patient Nicole's appearance by focusing on her upper and lower lids. Have a look.
I've never had any cosmetic surgery before, so this is the first one. The reason why I want to get this done is because it's genetically in my family, dark circles and puffiness around the eyes are very common. And as we get older, they get progressively worse. So since I turned 40, I started noticing a big difference in the puffiness. And I'm just really tired of people always saying to me, I look tired. So I just thought this would be a great opportunity.
Nicole, so good to see you again.
Nice to see you too.
Nicole's procedure was an upper and lower lid blepharoplasty with a little bit of under the chin skin lipocontouring. So the procedure would be divided into upper and lower. In the upper lid, generally we're looking at extra skin, maybe a little extra muscle, sometimes fat. So we remove a little bit of skin, a little bit of fat, a little bit of muscle, and we hide that incision in the upper eyelid crease so you can't see it. In the under eye, we use a very stealth approach. We take the fat pads out from the inside of the eye where the pink is. It sounds kind of gross and kind of creepy, but remember it's under local anesthesia, so we steal the fat pads from behind, so actually there's no lower lid scar. There can be some bruising, there can be some discoloration around the eyes because there's a lot of little vessels, and so most patients should anticipate 1 week off and then into makeup.
I feel great. It's the first time that I can actually go out and not have someone look at me and go, wow, you look really tired. There's no puffiness. It's just smooth skin. It's easy to apply makeup. And it's just, overall, I feel younger.
It's dramatic. Please welcome Dr. Mulholland live in studio with us. That is amazing. So she only had to do that once.
Yeah, one-time procedure.
One-time procedure. Now, I always start with this. Is it painful at all? Because you think about the skin around the eye, it tends to be thinner, which might make it a more tricky area to deal with. Is it a painful procedure?
You know, the eyes are really probably one of the most common things that we do because they are the windows of the soul, and that's where we're trained to watch.
Yes.
And society's trained us guys never to look at cleavage anymore, so we look right at the eyes.
You're so not allowed.
Right at the eyes, and of course, the windows of the soul sometimes guarded by the gates of hell.
Yeah.
And that's skin, discoloration, and bags. And so it's delicate tissue, but not overly painful. Like a bruise meets a sunburn for about a week. Far less painful than looking old and tired when you're not.
Yeah, absolutely. Now, what are the risks, if any, involved with this?
Well, like any plastic surgery, there's going to be some risk, but it's a fairly small area around a delicate organ, the eyeball.
Yeah.
So you want to protect the eyeball from injury, and then usually it comes down to bruising, slight asymmetry, delayed recovery, usually things that can be adjusted or fixed. Usually eyelids work out very well.
How long is the recovery process anyways?
Depends what you do, but in general, it's about a week until you're into makeup. So there's none of this sort of weekend or overnight recovery. And usually start with diet and exercise and maybe a little Botox and filler and great makeup like our artists today. But at the end of all that stuff, sometimes hereditary issues catch up with you and you just got mom and dad's bags, and sometimes even when you're a teenager you look in the mirror and go, oh my goodness, you know, this is hereditary, not aging. So
it is a hereditary thing. Is there a certain age when people, like, it's a better age to opt for this whole eyelid procedure? You know, if let's say you inherited a big eye and a sunken socket and dark bluish skin and bags and you're in your early mid-20s, rarely, sometimes that's when you start, but for the most part, eyelid surgery takes over from Botox filler and photofacials and healthy living in your mid-30s to 40, often it's the eyelids, and then mid-40s the brow and cheek, and then maybe in your 50s, 60s the neck. So you're renovating one room at a time, and the eyes are the first room. Right. So, but does it make a difference if you do it at 20, 30, 40, or 60? Does it make a difference? Not really, because the fat we remove never ever comes back. And sometimes the skin wrinkles will come back and a little laser will take care of that. But it's usually one surgical maneuver to renovate the eyelids, and you're usually good for the rest of your natural born days. That's amazing. Does it change at all the skin tone, or does your actual skin tone make you more or less eligible for this sort of a procedure? So the darker the skin, the less likely we're going to use laser treatments, and then we use other tactics for darker skin types. And so Asian or Canadian, Caribbean patients are candidates, just with different techniques. The lighter the skin, the more often we can deploy laser work for some of the fine lines and wrinkles. And why is that? What do the lasers do on darker skin? Well, generally for the lower eyes, when you're trying to get the little crinkly crepey
atrophy skin, you're going to use a laser that may alter the pigment. And if you have light pigment, then it won't be as much of an issue. When you have darker pigment, usually we rely more on skin pinching and removing.
Okay, and what are we talking about in terms of cost? Is there a range?
It really depends whether it's upper or lower and how difficult each of the lids are. But in general, most Canadian patients can look at somewhere between $2,500 and $4,500 for uppers alone or upper lowers together.
Okay. Nicole got a little bit of upper and lower done, and she's actually in our audience right now. Such a dramatic before and after. So, Nicole, I want to ask you this. You look absolutely stunning. Why did you decide to do this now?
Now, because I'm 43, there's been a lot of changes in my life, my personal life in the last year and a half, and I thought, what better time to do something for myself than now? So I went ahead and booked the appointment. And it's also, like Dr. Mulholland said, it's hereditary, and I have an older sister. She's 3 years older than I am, and I've watched hers progress to a point where she really wants hers done, so I know that mine will continue to get worse, and I thought, let's just nip this in the bud now and go ahead and do it. I feel great.
You look phenomenal! You look so good! And there are so many people that are on the fence when it comes to getting some kind of a cosmetic procedure because, you know, they're afraid of the pain like I am, or they just don't know if it's worth it or not. If you're getting up every day and someone's saying to you, you look tired, there's something really annoying about that. And, you know, it's one of those situations where it is hereditary. She didn't really have any control over the situation. It made perfect sense.
It's completely true. I mean, many of my eyelid patients, blood patients, would never do a facelift. They're never going to do liposuction. But they've been afflicted with something that no matter how much rest they get, there's probably nothing, well, more annoying than someone saying, oh, did you get any sleep last night? You got a wonderful sleep. And so blepharoplasty surgery is restorative and functional in that sense, and not only just cosmetic. It really does make you look more rested. It's not about youthful all the time. It just makes you look fresh, alert, and rested.
For sure. You did a great job. Nicole, thanks so much for chatting with us as well.